Welcome to Her Fertility, the podcast for women navigating infertility who want to feel like themselves again while they do it. I'm your host, Jess Timms, researcher, educator, and somatic practitioner, and I've been exactly where you are. I know what it feels like to be in the waiting, in the not knowing, in the relentless hope and grief of this journey, and I know there is a way to move through it fully alive without losing yourself in the process. Every week, I bring you honest conversations, real research, and the kind of support your clinic can't prescribe. This is Her Fertility. Come on in. I am delighted to be joined today by Professor Lopoo. Professor Lopoo is an expert in fertility policy, and this is something that we have yet to really explore here on the podcast. So, welcome from the East Coast to the Her Fertility podcast.
Thank you, Jess. I'm delighted to be here and look forward to our conversation.
We were just chatting before, and this is bringing me back to when I was getting my master's in communication. I think there's such a need now more than ever to really talk about these things. Dr. Lopoo recently wrote a book, Wanting Children. In it, you talk about American reproductive policy and how it's historically been focused on preventing pregnancy among low-income populations and really largely ignoring fertility support and equitable access to fertility care. And so this has a lot to do with race and class and shaping reproductive policy. Can you tell me more of what's in the book and why people should read it?
Yeah, and that was a super summary, Jess. I've been working in this field for 30 years now. I started off trying to understand which policies actually promote fertility, which is something that we haven't thought as much about in the United States, but in European countries and Asian countries where their fertility rates have gone down dramatically, they think a lot about what can government do to try to encourage people to have children. And that's the space that I've spent most of my life studying. What happens when government provides health insurance, or what happens when government provides childcare? And does that affect family formation, which is the broader topic that I study? And as you said really well, one of the spaces that I really started to focus on was how do we think about family planning in the United States? And family planning in the United States, at least from a government perspective, is very, very different from what family planning means in many nations. In Europe, for example, family planning really does mean both how does one help control fertility so people can have children when they're ready, but also if someone needs assistance through because they have some infertility issues, that there's support there as well. It's sort of both sides of the coin. In the United States, we don't have both sides of the coin, at least from a government support perspective. Exactly as you said, our family planning and their programs at the state, local, state, and federal level, the federal programs are really large, and they really do just focus on low-income families and providing contraception and other reproductive health services. And as someone who's spent so much time there is an explanation that you can get that makes a lot of sense. But if you think about it a little more deeply and you recognize the history that we've had in the US, you start to question some of those motives. If we're only providing for low-income people to not have children, one starts to think that that's probably not an equitable system and something we should really probably discuss more.
This is so fascinating. I'm so grateful for the conversation now more than ever, but I can't help but really think back. Is this something that, like, does the book span a more recent history or do you go back?
Oh, I do go back.
Yeah, okay, so you go back. Okay.
I do go back. So if you pick up a book and you read the history of Title 10, which is a program that provides support for clinics for low-income men and women, or the Medicaid program, which has a very large family planning. It's a health insurance program for low-income individuals. You'll see that these started in the early 1970s. And so certainly go back to the 1970s, but I think a book on those 1970s would say this was programs that were created for health equity. The idea being that if you are a middle class woman growing up in the 1970s. You have lots of opportunities that weren't available before in education and labor markets. And sort of policymakers claimed, and this is true, but this was the only part of the story, was that, well, we want to be equitable. If we're seeing opening of markets for middle-class women, affluent women, we should have the same opportunities available for women with fewer resources. And of course, that's absolutely right. So a lot of the justification, if you really go back and read like the congressional, reports and things like that, they'll say this is about health equity. And it's true. But I go back even farther than that. I go back into like the late 1800s and the early part of the 1900s in the United States, where there was a lot of emphasis on stopping what they called at the time very harsh language, kind of undesirable people, or people that were really having too many children. And people were very concerned about that. This is the eugenics movement. Many of your listeners are probably very well aware of. A lot of the developments with respect to birth control were very explicitly designed to control the fertility of, again, these populations that were that people said were having too many children. And so if you go back in history and you look at sort of this timeline, it's almost as if people think up until 1970, people thought a particular way, which is this more eugenic way, and then suddenly something happened and people thought differently, and it was and that history just didn't make sense to me. So part of what I do in the book is I go back and I read congressional reports, and I look at interviews, and I even have, Richard Nixon tapes to go back to when he and his policy advisors were talking about these programs. And what they said publicly was very much, we should have these health equity reasons. If this is available to a middle-class woman, it should be available to a low-income woman. Of course, that's true, and I unquestionably believe that. But then when you listen to what he was saying in the White House, it was very it would be very hard for your listeners to listen to. Yeah. It's very much racially motivated. It's very much class motivated. And that's part of what I do in the book, is I say, we really need to be a little more honest about what's happening here and what happened and what that legacy has meant, because these programs still exist today. And that can be part of the explanation for why you only see support for contraception in our programs, and you don't see support for infertility in our family planning.
Fascinating. And I can't, I do feel the need to verbalize the fact that, even now, we're two white people who are privileged to be able to talk about this, but yet these are programs who are, lack of a better word, targeted toward controlling populations that are not white, right? Or of a different, so there's two parts here, whether you can afford, so the economic status, but then also the race problem. And so that I'm clear, it's interesting because I love the comparison to other nations where you're saying their programs from a government perspective would provide access to both birth control and family planning or getting pregnant processes. Is that right?
Absolutely. So to go back to your point just a moment ago, there's definitely a race and class component there. There's also a geographic component there. Rural populations, I think, were sort of part of the conversation. Yeah. This was very comprehensive in terms of the groups that were discussed as having lots of children, and perhaps that was a concern.
To clarify on that point, more of having true control over which populations reproduce and which don't.
Well, there was a period in the United States history when different groups, people with cognitive disabilities, for example, were sterilized involuntarily. Yeah. So that was the law of the land. There were Supreme Court decisions in the early part of the 1900s that made that the law of the land. And very well known, even today, jurists made those decisions. People like Oliver Wendell Holmes talked about that. We also have nearly every president for the first half of the century being a very clear proponent of this way of thinking. So it wasn't just, again, when you read the history, it's sort of like, wait a minute, why are we starting in 1970 when you have presidents talking about a lot of our population shouldn't be reproducing? We really need to recognize that and realize that that is part of the history. And again, why I think you don't see infertility supports in our programs even today.
Yeah. Yeah. And so the second part of that question, and really what you just opened up again, is that other nations have government support for not just birth control, but also infertility. And we're starting to see this conversation kind of in the United States, but largely access to fertility treatment has been for the wealthy. Like it's very expensive. And we're starting to have the conversation where we can have coverage more available. But how does that tie in?
Yeah, so great question. So just to give you and your audience a little bit of background, if it's helpful, there are a lot of countries that have much more expansive, what they call family planning is very different from what we call family planning. So if you look at something like the UN or any kind of international reproductive health organization, they all have very similar definitions, which say very simply, family planning should help people that want to control their fertility, and people who want to have children, that's kind of a right. That is an important human right, the ability to have a child. And so if you have an infertility issue, family planning should support that, should provide whatever science can do. If you look at a country like France, they're very, very progressive in terms of family. Family is very central to the way that they think about French culture. And so support for IVF, for example, is very extensive. If you go to a country, and a Scandinavian country, many are very expansive. Poland, Estonia, it's not very difficult to find European nations that will provide not just even one cycle of IVF, multiple cycles of IVF. They tend to be less restrictive in terms of age, or that it has to be a heterosexual couple. So much more progressive. We see Quebec in Canada is very progressive as well. In the United States, family planning, at least as far as government is concerned, is just the contraception. It does not provide any infertility supports, which we've already talked about. And you've also mentioned, there's a private side, of course, in the US. It's not just public health insurance, it's private health insurance. And even within private health insurance, most states do not mandate any coverage of infertility supports. And when they do, it's often quite limited. It might be ovulation stimulating drugs are covered, but IVF isn't, or you need to be 5 years to be declared sort of by a physician as being infertile for 5 years before you're eligible, or you need to be in a heterosexual marriage, as I alluded to earlier. So in the US, it's much more restrictive, and in most states, you can't even get that kind of support from private health insurance either.
Yeah.
Which again, I know that many of your listeners are very well aware of.
Yeah, it's fascinating. Like I'm here on the West Coast in Los Angeles, and you're on the East Coast in New York, and there's a world between us that has there's a lack of access to even the clinics themselves. We have fertility deserts, but then there's also a lack of access to any support around fertility treatment. And it's fascinating because like when you were talking about that, I was at the last ASRM conference, so the American Society of Reproductive Medicine, sharing research around support. And there was a whole panel from other nations talking about their fertility programs and really informing the American Society of Reproductive Medicine on what they have in their country. And now that I'm hearing it from this perspective, I'm like, oh yeah, because they are a leader, right? Like they have a different policy, longstanding policy in providing governmental access. And they were sharing how that's working, the challenges they're having. It was a really fascinating panel. So I was thinking,
we have started to have these conversations. I think important conversations. Politicians are starting to realize this is an important issue to many people. I think that a lot of nations are ahead of us, partly because they've experienced a lot of fertility decline long before we have in the US. So there are important equity issues, I think, that we should be discussing and have discussed about why support for infertility is so crucial. But I think many nations have come to the realization that they are not people are not having nearly as many children as they used to have.
Yeah.
And so can government become involved to try to increase the fertility? I mean, some nations in Asia and parts of Europe have fertility rates that are around one, and even some below one, so one child per woman. And the demographers would tell you need about a little over two to just sort of sustain your size. So we're at that point now. We've gone below two in the US, but it's been much more recent. I think in Europe, they've been dealing with this for decades, in Asia, even longer. So we're starting to have conversations that we should have been having long ago. And that's part of the story as well.
Fascinating. Is there anything that we can do moving forward to make this shift? Having the conversations you just mentioned, voting on policy that expands access, is that the goal?
It is the goal, and I have some pretty specific recommendations in the book that I'd be delighted to talk about. But I think the first place that I would start, which is kind of where the title comes from, Wanting Children, is I describe that in the US, we're really kind of inconsistent in the way that we think about our population or our demography. There have been times when we don't want our population to grow. There are times when we think the population should grow. We really don't have consistency between family planning policy, abortion policies. It's sort of whoever's in office and whatever they decide to do. The book says we should be a little more consistent in the way that we think about these policies. And the really important thing that we should be doing, that's a thread that I think could be guidance, whether you're on the left or the right side of the aisle politically, is that we should be helping people have wanted children. And by that, I mean, there's incredible volumes. I should say there's a lot of evidence that having a child that's wanted, and by that I mean one where parents prepare for it prenatally, where they think about it financially, emotionally, with family, right? Where you have a real process of deciding to become a parent, that the children from a family like that excel and in every dimension, education, employment, psychological outcomes, nearly anything you can think about. A child that grows up in that healthy family environment, and again, that's not about a socioeconomic question, that's not a geographic question, that is about being prepared to be a parent. So we should have policies designed to help people who want to be parents to have them, and that people who do not want to become a parent to not have children. And right now we have inconsistency for both groups. And so the real point of the book is to say a family planning program that has only half, that helps people to avoid becoming a parent if they don't want to be, is absolutely the right way to be thinking on that side. But the other side of the equation is really lacking. We have about 1 in 6 people roughly that we believe that are infertile, many of whom would like to have children. And that's where we should be focusing our attention if we're trying to grow population, which is a lot of the political conversation right now. There are a number of people who want to be parents that we can really help in so many ways, and socially help in so many ways, if we help parents who want to be parents to succeed. And that's really the big theme of the book, and again, where the title comes from.
That was like taking the biggest breath of fresh air I have ever heard around this conversation. I'm so grateful for that perspective, because ultimately that is such a beautiful goal and such a beautiful place to come from. Like the intention around, okay, we're going to have these policies so that there are wanted children, and that the intention is to then support people in becoming parents. I feel that this conversation often, it does become about left or right or religious beliefs or not, or whatever side you want to pick. And at the end of the day, I love that so much around that is such a beautiful place to come from. And we're going to support our citizens, whether they want kids or not, and we're going to support them through that. I mean, it like brings a smile to my face. Like I can see how that then creates just a different culture around families. Like you were mentioning other nations and their families. It's just different. And now I can understand how that's different.
Yeah, thank you. I mean, it is, I hope, a way to cut through all of those issues that you described, because no matter what your thinking or leanings are, there's no question that helping people who want to have children, to have them, the people who are going to invest so much time and money and sleepless nights. I mean, it's the beauty of being a parent, right? It's why those bonds are so close, because you really are thinking about everything you can do to help your children to succeed. And that's really what we should want. We should want many, anyone who wants to put all that time and effort and love and attention into becoming a parent, into their children. Why wouldn't we do that? And you're right, in many ways it's simple, but when you start to look at the map of our programs and our policies, particularly in the United States, you see we don't actually think that way. And in many times we're contradicting that. And so again, I hope maybe a kind of a unifying theme. And that really was the thing that drove me to write the book, was to say, we can, I think, probably agree that it's a good idea if this young woman wants to have a child and is really going to, love the child and devote time to the child and money to the child and spend time with the child and be better because they are a parent,
Yeah.
then we should be trying to do that. And I just think if we can agree there, then the policy starts to roll out in a much more understandable way.
It's so beautiful. It's such a beautiful perspective. And yeah, like public policy is not that fun to think through or read through or any of that, but it does impact our lives and how, we have access to things or we don't. And so I love this. And I definitely want to name that, like, Dr. Lopo, normally your work would live in academia. Like it is definitely a labor of love that you've taken on to write this book and get it out to the public. And so tell us more about the book and how we can get it.
Yeah, thanks, Jess. That's true. I have spent all of my 30 years that I mentioned earlier writing academic articles and presentations and reports. And this was me sort of taking a step back and saying, I don't know that the conversations we're having are productive. And, is there a way for me to help us start maybe a more productive conversation? And you're doing an amazing job. I've been listening to your podcast and what, people who have such an interest in this space might want to talk about or think about more. So thank you for recognizing that. The book is available where you would find any book: Amazon, Barnes and Noble, wherever you buy your bookstores, online. You can get it, and I really hope people will enjoy it.
Yeah, I really think they will. I find that, this is an experience for someone they didn't ask to be here, right? You don't ask for infertility, you find yourself here. But what it gives you is a definite new understanding of the problem. And I'm well removed from my own infertility journey, but I'm still having the conversation because it's a journey and it's something that you're working through. And so when you have more tools and references and resources and new perspectives to have a better conversation around it, whether you're in infertility currently or after infertility, or you just want to know more, this book is such a great resource for that. And I think especially now more than ever, where we're having these bigger conversations about like who we are as a country and what changes we want to see or don't want to see, this is pivotal to that conversation. And I would hope that all of our listeners would pick up the book, read it, so that you can be a part of that conversation as it continues to unfold. Because even though we've been talking about historically, I think you are right at the precipice of what we need to be talking about moving forward.
Yeah, the book, Thank you. Thank you so much, Jess. That's really helpful. And I completely agree with you. The book does talk about history, but it also talks about what we should be doing. And it even talks about the future, that we are moving into fertility technologies, not just with IVF, but with genetic testing and the choices that people are going to have to make going forward, some of the ethical issues that are coming up. I really do think that your listeners would enjoy not just thinking about the history, but sort of where we are moving in this space and some of the questions that are going to come up, how more people should be given access to the kinds of resources we're talking about with medications, with the technologies, with the testing, with the IVF. And so I sort of lay out a plan that I think many of your listeners would find interesting and certainly a good launching point for more conversation in this area.
I love that so much. Thank you. Thank you for putting this out into the world and bringing all of the knowledge along with the conversation. I think that's really what I'm craving more of. I can really only speak for myself, but I'm craving more of that where we have this research and this information, this history. Now, how can we use that to move forward in a way that's benefiting everyone and really beautiful? So I'm so excited for the book. It is
Well, thank
Wanting
you.
Children, and we will have it linked in the show notes. Thank you. It's such an honor to have you on the podcast. Thank you so much.
Well, thank you. I certainly enjoyed our conversation. This has been terrific, and I really love what you're doing, and keep up the great work.
Thank you. That means so much. Thank you for being here today. If something in this episode landed for you, that feeling is worth paying attention to. If you're ready to go deeper, the Her Fertility Support Portal is where this work continues. It's a monthly membership built for women who want to feel genuinely supported, not just medically, but emotionally, somatically, and in community with women who actually understand. You can find everything at herfertility.support. And if today was your first time here, welcome. Come back. There's more where this came from. Until next time, give yourself grace. You are doing more than you know.